Hello, my name is Jessica Zike, and I am a registered nurse currently working in the postpartum section of the birth center, and I care for mothers and newborns. I am very passionate about teaching and is my favorite part of my job. I love empowering mothers with new knowledge about their health and that of their newborn as well. Breastfeeding is a topic I spend much of my time educating my patients on, and seem to find that the majority of mothers I care for do not have proper knowledge in relation to preparing them to breastfeed. I chose to research this topic because it is near and dear to my heart, and I wanted to find out if prenatal education in this area would impact outcomes and help moms to be more successful. My research question was, in postpartum patients who plan to breastfeed, how does prenatal breastfeeding education, promotion, and encouragement, compared to no education, influence successful outcomes in the first months postpartum? It has been recommended that mothers breastfeed for at least the first 6 months of life because of compelling importance and research benefits. Only some of the many benefits of breastfeeding include a defense against infection, obesity, and even disease. Over the years, breastfeeding has been an option but not always encouraged. Different factors may attract or deter mothers towards the journey to nourish their child with breast milk or to utilize other options. Prenatal intervention can help to encourage breastfeeding and can help to avoid another taken path, such as supplementation. Education, resources, culture, and the ability are just a few of the factors that can affect mothers and their choice to breastfeed. Maternal success in relation to breastfeeding includes support and is heavily reliant on the mother's personal choice to follow through. As research regarding this topic continues to develop, care teams should be made aware of the most ideal practices and teaching opportunities in order to intervene in the breastfeeding process to help improve each mother's experience and successful outcomes. I chose to study 3 research studies and reviewed all 3. The 3 studies were reviewed from 2013 to 2018. The goal in mind of each study was to evaluate outcomes in regards to breastfeeding and antenatal or prenatal education. The sample size in each study included antenatal women. The largest study included 888 mothers, the next 366, and lastly 124. All 3 studies mentioned resulted with a commonality that breastfeeding education during pregnancy increases the rate of successful outcomes. Increased self-efficacy was an encouraging aspect, helping mothers to do well and achieve success in the end. Next, I'd like to talk to you about each research study and what it entailed. To start, I'd like to talk to you about the first study. This article had a study called The Effect of Antenatal Education on Breastfeeding that included self-efficacy in primiparous women in Turkey. This study was conducted as an intervention study to evaluate the effect of antenatal breastfeeding education on breastfeeding, self-efficacy, and breastfeeding success. The study concluded that antenatal breastfeeding education and support were given to pregnant women, which ended up helping successful outcomes occur. Evidence from the study demonstrated that breastfeeding education, which is related to the self-efficacy theory, contributed to increased successful outcomes. Going on to the next study, in the article called Participation of Pregnant Women in a Community-Based Nutrition Program had to do with a nutrition program conducted using a cross-sectional study and inline survey. The conclusion of this study was that prenatal enrollment in community-based programs working on child nutrition did improve exclusive breastfeeding practices in mothers. The program provided clear evidence of positive association with enrollment of children while in utero and exclusive breastfeeding. Lastly, the article called Increasing Breastfeeding Rates to 6 months Among Women used a quasi-experimental study. This was a non-randomized evaluation design and used an intervention to enhance breastfeeding rates until 6 months postpartum. In conclusion, assignment to this intervention was associated with significantly higher rates of breastfeeding compared to no assignment at all. All three research studies shared a common finding that antenatal breastfeeding education produced successful results in breastfeeding mothers. Also, the three studies agreed that a modifiable factor to initiating successful outcomes with breastfeeding mothers involves some sort of teaching prior to birth. Although the literature shared a common result of successful outcomes for breastfeeding mothers, there were some differences among their results. The differences may be attributed to culture, demographics, and location of the studies. Other factors to take into consideration are details about the study and measurable outcomes. Each study was conducted differently with incomparable results. In one study, early education increased breastfeeding rates from 31.4% to 54.3%. In another study, breastfeeding success scores were almost 2 points higher than those receiving no intervention. The last study showed a 10% increase in exclusive breastfeeding for mothers educated prior to birth compared to those who had postnatal education. As far as recommendation for nursing practice, I believe that breastfeeding education and outcomes can be significantly increased with simple modifiable factors in a woman's journey to motherhood. Although there is sparse research currently to adequately cover this topic, the data provided certainly gives importance to some type of antenatal or prenatal breastfeeding education. There is always room for improvement in the area of patient care. Breastfeeding education is crucial to the success of breastfeeding mothers, as well as positive outcomes for infants. It would be my strong recommendation to encourage a change in the current practice with pregnant women. Evidence has shown positive outcomes when prenatal breastfeeding education is incorporated to a mother's care. The Healthy People of 2020 initiative aims to increase breastfeeding rates. To help facilitate this goal, the American College of Obstetricians and Gynecologists calls for a multidisciplinary approach that involves community, family, patients, and the healthcare team. I plan to discuss a plan with people I work with, including midwives, doctors, and even antenatal nurses, to relay the current evidence in relation to this topic and present a plan to prepare women for this tough yet rewarding journey towards breastfeeding if they so choose. My plan will include teaching in the 3rd trimester of mothers who wish to breastfeed or who would like the education. This education could be a class or a session offered with an appointment with their provider, or in the hospital if they are in the antenatal section. I will provide handouts with information regarding current evidence in relation to the entire spectrum of breastfeeding. This will include benefits to the mom and baby, correct techniques to utilize, what to expect as far as the best times and the worst hardships that may come with this process. This plan will help breastfeeding mothers be more prepared, self-sufficient, and independent. In the end, they will be more successful and hopefully breastfeed for longer with better outcomes. I will monitor the results of my teaching through follow-up appointments at the hospital in the postpartum section. I would love for people to breastfeed for as long as possible, and I plan to monitor this. Thank you so much.